Good afternoon, everyone, and welcome to the Multicultural Media Online Forum here at New South Wales Health, hosted by Ministry of Health, Multicultural New South Wales, and the Multicultural Health Communication Service. I'm Jesusa Helaratne from the Multicultural Health Communication Service, Deputy Director, and thank you very much for joining us today. We are like to begin by acknowledging the traditional owners of the land where we're all meeting from today. From here in New South Wales Health, St. Leonard's, we acknowledge the traditional custodians of the land, the Guringai tribe of the Eora Nation. We pay our respects to elders past and present, and also pay respects to the multicultural elders who are represented today in this meeting. We'd like to also, for the purpose of this recording, explain to you that during this recording, we will, inside the studio, we will be taking off our masks for the purpose of clarity of information for those who may have some information who may not have, who hearing impaired and need to lip read. We'd also like to request if you can please keep your mics on mute as we only have 30 minutes for this session. So now would like to begin by welcoming Minister for Health, Brad Hazzard, Minister for Multiculturalism, Natalie Ward, and of course, Deputy Chief Health Officer, Marianne Gale, Dr. Marianne Gale. So let's begin. Minister Ward, I think you have some messages for us today.
Thank you so much, Jess, and thank you, everybody. It's great to be here again. I also acknowledge the traditional custodians, pay my respects, and also to elders, past, present, and emerging, and each of our multicultural elders. Thank you. Each week I've spoken to you and we've had discussions about the critical importance of getting vaccinated and of staying at home. We know that in recent days the numbers have increased and restrictions tightened, which is not what we want. Vaccination is our pathway forward, and so is following the critical health orders. Those orders are in place to keep us safe. Our religious and community leaders, along with you, our wonderful multicultural media, have done the fantastic work in delivering those important messages. So once again, thank you. Let's keep it going. Let's get the messages out there as you've done so well. We are at a crucial stage. So I just want to thank you all for getting those messages out. The best vaccination is the first one that you can get. Just get the jab. It's the safest thing to do. It's critical that we talk to our health professionals if we have any concerns. If you've got any questions or concerns, just ask questions. They are there to help. If you've delayed getting a vaccine for any reason, any concern, you can speak to your health professionals and get them to clearly explain why it's important to get that jab as soon as you possibly can. I know these can be difficult conversations and sometimes uncomfortable conversations, especially with family members, but we absolutely have to have them. It's critical. We recognise this is a very tough time for many, and I just want to particularly acknowledge those who may need urgent help, particularly our asylum seekers and temporary visa holders. I'm really pleased to say that applications have now opened for non-government organisations to apply for a share of our $5.5 million in funding that we've recently announced for these NGOs to help asylum seekers who need that emergency support to get essentials like food and medical care, help them meet their rental payments and get them to medical support. We want that money to go out the door as quickly as possible to get to those who need it. We've also announced a new $400 hardship payment payable through the Red Cross for temporary visa holders and others in the community that are not eligible for other government financial support. Again, that's to help meet basic needs like food, medicine, shelter. And the Australian Red Cross has received that funding specifically to support people who don't have access to the Commonwealth income support. So I just wanted to call that out. It's available. It's for temporary and provisional visa holders, as well as people who may not hold currently any other valid visa who are facing extreme financial hardship. So the response to that I expect to be very good. Thank you for the interpretation of the daily 11 o'clock COVID news conference. It continues to be getting an excellent response and is now being done in 6 languages: Arabic, Syrian, Mandarin, Vietnamese, Khmer, and Cambodian. I'm told that there's more than 500,000 views across Facebook, Weibo, WeChat, and Twitter, which is fantastic. And of course, this week, SBS has started to broadcast Arabic and Vietnamese live interpreting on SBS TV and SBS On Demand, and particularly listening to the feedback from our religious and community leaders and And thank you to each of you that have been in touch. We've had one-on-one conversations, we've had community forums, but regarding that feedback, we're acting on that, and it's our highest priority. So thank you for those thoughts and the feedback. It's really important. Of course, the Premier and I have also picked up the phone many times to individual leaders one-on-one to hear their feedback. So it's important that we are listening to you, and that we are here and we're available for that feedback. Thank you very much, Jess.
Thank you, Minister Ward. And I think we'll go straight to some updates. Dr. Marianne Gale.
Yes, thank you very much, Jess, and good afternoon, everybody. Thank you for having me here again. So in terms of the numbers, to update you all, since 8 p.m, well, to the 24 hours till 8 p.m. last night, there were 633 locally acquired cases of COVID. And clearly, we are very concerned about this increase case numbers, and particularly concerned about the burden of cases that we are seeing in the Western Sydney and Southwestern Sydney areas. And we know that the communities of Western Sydney and Southwestern Sydney are very strong and well-connected and resilient communities, and have done a terrific job throughout this pandemic to follow the public health orders, to come forward for testing, to get vaccinated. And I particularly appeal to our communities of Southwestern Sydney and Western Sydney to keep on that great work and continue to follow those orders, to stay at home, to please get tested, even if you have the mildest of symptoms, and to get vaccinated. So that's a really important message, and our key message for today, and particularly to our wonderfully diverse communities in Southwestern Sydney and Western Sydney. Yep, that's really my big plea for today.
Thank you, Dr. Gale. We'll start with the questions from Fred Zhang, chief journalist from Sydney Today. He said, words are around social media that more than 500,000 Pfizer vaccine in New South Wales received from Poland are expiring soon, and lots of people are concerned. Can you confirm this, and does this influence the efficiency of the vaccine?
Thanks very much. So clearly in New South Wales, we're very pleased to have this additional vaccine that the Commonwealth has procured, and we have these doses available to the population of New South Wales, targeted at that 16 to 39-year-old age group in our 12 most affected LGAs of the Greater Sydney area. And we know that it's those areas where we're seeing the greatest drivers of the case numbers at the present time. And as I mentioned earlier, particularly LGAs in that Southwestern Sydney and Western Sydney area. So the Pfizer vaccine that's come is a perfectly good vaccine. It's come through the usual Commonwealth channels, has been approved by the regulators like any other medicine, like any other medical product. It's a great vaccine. It's a wonderful thing that we have here to be able to vaccinate that young population of 16 to 39 in our 12 LGAs of concern in Sydney. And I would urge everybody who is eligible for that between the ages of 16 and 39 in those 12 LGAs to please book in for your vaccine. The booking link went live today, so please do so. I strongly encourage you to do that. And for all others in our communities, please take every opportunity to get vaccinated with any vaccine that is available to you, whether that's Pfizer or whether that's AstraZeneca, as soon as you can.
Thank you, Dr. Gale. Here's another question. We had some 30 cases in early June. We stepped into lockdown. Now we're in lockdown for nearly 2 months, but the daily new cases have grown to near 500. Does this mean lockdown is not working? Why is it not working? And will we see tougher measures like work permit and curfew in Victoria? Minister Hazzard?
Look, obviously it continues to be a problem. As Dr. Gale just said, there are some cases across New South Wales, but by far the majority, in fact, more than 80% of all of the cases that we had today are in Southwestern and Western Sydney, in those 12 local government areas. So the short message is you can only stop this virus from spreading by staying at home. Don't visit other households. It's a very simple message. And also get vaccinated with whatever vaccine is available. Stay home, stop the virus from passing one to another, and get vaccinated. but there's nothing else we can really suggest at this point. It's just so crucial that people listen. I think it's challenging in some cases because people think that they're okay when they don't have symptoms, but the reality is you can have no symptoms and yet you can have the virus and you can pass it on to somebody else, and it might be your mum or dad or uncle or aunt or cousin or sister or brother, and they might die from it. So we can't afford to have the virus circulating anywhere in southwestern or western Sydney, or indeed anywhere in New South Wales.
Thank you, Minister Hazzard. Here's a question from Kevin G. from Daily Chinese Herald. Regarding the epidemic in New South Wales, has the mortality rate increased compared to before? And why is the infection rate among young people so high in this epidemic? Is it caused by the Delta or other strains or other reasons? Dr. Gale.
Thanks very much, Jess. Yes, compared to what we saw in 2020, previous strains of the virus, clearly what we are seeing with the Delta virus is far more cases in younger people, and that's clearly been the phenomenon that we are observing, and why many of our messages and our advice around vaccination and our targeting of young people with vaccination is so important. So yes, young people are seeing more of this virus than with what we observed last year in 2021. We know that also children are more likely to get the virus and more likely to transmit. And we have seen cases occurring in childhood, early childhood centres and in schools. So a very clear message for young people is to please get vaccinated. Please stay home. Do not go out unless you have a reasonable excuse. Stay within your household. Do not visit other households. Very important messages for young people. Thanks, Jess.
Thanks, Dr. Gale. A question from Pawan Luthra from Indian Link. Question for Minister Hazzard and Dr. Gale. According to the Fed's Health Department, there were 3,035 locally acquired cases in Australia till yesterday, which was 94% in New South Wales. Something in the current restrictions is not working. People are scared and tired. Why are the settings not being changed to tackle this reality of increasing daily cases?
When 80% of the cases are coming from southwest Sydney and western Sydney, the issue is what else can we do? And at the end of the day, it's up to the community to actually comply with the orders, but also just our common sense requirements. And that is, as Dr. Gale just said, do not mix households, do not go outside your household. And if you happen to be someone who's positive and you're returning to your house, you're not going to hospital because you're not sick, but you still have the virus, you need to make sure that the rest of your household also stays home during that period, or at least follow the health advice, as this virus is so transmissible that almost every household that gets one person will find that all or most of the household gets it. So people just need to stay home. And that's the setting that, unfortunately, is not being complied with as well as perhaps it could be complied with.
Thank you, Minister Hazzard. Another question from Indian Link is another question for Mrs. Ward. I'm aware of the number of businesses, especially restaurants, who want their employees to be vaccinated, but are worried about legal issues if they mandate it. There are small businesses not like SPC or Qantas who might fight or who can fight off any litigations. Can the state government not bring in any laws as part of public health and safety to stand in the business owner's corner? Minister Ward.
Thank you, Jess, and thank you for the question. Look, the number one thing at the moment is the safety concerns. We want everyone to follow the health advice so that we can get out and reopen, but we can't do that until we have a level of safety in the community, and that means two things: stay at home and get vaccinated and get tested if you have any symptoms. In the meantime, this government, the New South Wales government, is doing all we can to support business in New South Wales, and we're looking if business wants to incentivise its employees to get the vaccination, we are looking at opportunities to assist businesses to get through this time. And so we're very keen for everyone to do what they can to stay safe first and foremost, and to get the vaccination so that we can reopen in time, and that's been very clear. But until then, we just simply need to stay home. We simply need to support these businesses as we have done, and ask everybody to do the right thing and follow the health orders until we can get to that place.
Minister Ward. A question from Lisa Pitts. The Afghani community in New South Wales have been traumatically affected by the situation in their country of origin. It would be natural for Afghani community to reach out to each other at this time, which may require physical contact. What message do you want to offer to the Afghani community, crucially at this time? Dr. Gale.
Thanks very much, Jess. And certainly our thoughts are with the Afghani community here in Australia. And it's, really awful to see the events that have unfolded in Afghanistan. And my thoughts go out to all the Afghani community who are dealing with this news. And, our sincere thoughts are with you. Having said that, it's a really difficult moment, and I totally understand people's need to want to reach out and be with each other at this time. But we really do implore you to find other ways to do that and to support each other, to do that virtually, by phone calls, all those means that mean that you don't come into physical contact with anyone else who is outside your household. And it's extremely important at this time that people do follow that advice. I know that it's difficult. I know that it's the thing that's extremely hard at this time when people are going through a terribly painful experience. But it is really important that our Afghan community looks at ways to support each other through any means other than being physically in contact with each other or visiting other households.
Can I just add to that? Obviously, what's happening in Afghanistan is terrible, but what could happen here is it's not more terrible, but it certainly would be terrible if, in the sadness of what's happening in Afghanistan, Afghanis here were to come together in a way that would cause Afghanis here to die from the COVID. And that is potentially what happens. We've had gatherings of people in this last few months in a range of areas where it's gone right through the entire gathering. We've had parties, we've had funerals that shouldn't have occurred with large numbers of people. Whilst both Dr. Gale and I and the entire government and health team are very sympathetic to the terribly sad situation for all of you that's occurring at the moment, it will also be very sad if by coming together, your family members, your friends and other Afghanis actually get the virus and die. So I'm strongly backing what Dr. Gale said. Do not do it. Find alternative ways to come together through videos, telephones, whatever, but just don't come together physically. It's a recipe for disaster.
Thank you, Minister Hazzard. A question from Wendy Etherington. If people are isolating at home because they're positive, what are the arrangements for providing food and necessities for these people? I have heard of agencies being called to help when it seems it should be the government that does it. Minister Ward?
Thank you so much, Jess. Yeah, it's a great question. And we have heard from feedback on the ground that we need to help, and that's exactly what we're doing. We're helping those NGOs get that support straight out to communities that need it, and they know on the ground exactly how to get that out and where it should go. We've put that support behind our community grants to support 150 community organisations to get those grants immediately. We made that a really quick turnaround so we could get that cash out the door, and that includes everything from food hampers to face masks to medical assistance. We really are getting out there in the community, and so we thank those organisations that are doing that. 150 of them. There is more funding to come to them directly, and so we're really proud of the work that they have done and thank them for that direct feedback. We were told that was needed and we acted on that straight away. So the NGOs, if any more is required, please go to the Multicultural New South Wales website and you can see the grants programs that are there and the organisations that can help.
Thank you, Minister Ward. A question from Viori Calvert from Radio Tungumpai. Would New South Wales consider putting the curfew on? And there have been some questions here as well.
Can I answer that? At the moment, obviously, we have settings in place that are required to be complied with by health orders, which have substantial penalties attached if people don't comply. But we're not actually wanting people to be penalised. We're not wanting people to be fined or possibly put in jail. What we want is people just to hear the message from our health team. Our health team aren't interested in people being penalised. They just want to save lives. So the directions at the moment, the orders at the moment are as a result of our health team's best advice. If that advice changes because the situation doesn't improve, then of course the government would take that consideration or take those recommendations into consideration in modifying the health orders. Curfews do have some limited usage. We've seen them used in various jurisdictions overseas and in Victoria, but at this stage that's not something which is on our immediate agenda. But as I stressed, nothing's off the table. Anything's possible if people are not able to come along on the journey with us and comply with the orders. In other words, stay home in your own home, with your own family, with your own household, not your broader family. They can be in maybe 10 or 15 different households. Stay in your own household, just those people you normally live with. And if we do that, and people go and get vaccinated as quickly as they can by whichever vaccine is available, there are plenty of places you can get it, then we will get through this. But as I said, it's possible, but not on the agenda at the moment.
Thank you, Minister Hazzard. A question from Malaga Voyage Media. It's saying here there are various barriers facing the Pacific Island communities with dissemination of COVID-19 and other services. Can we confirm if there's information on COVID-19 and other services that's reaching the Pacific Island communities in New South Wales? Minister Ward?
Thanks, Jess. I missed part of the question because it dropped out, but I think it was about the Pacific communities, and we held a specific Pacifica forum last week, and I just want to thank Multicultural New South Wales and each of the entities that came along and the leadership in those communities. That was very useful in getting that messaging out. We're doing specific messaging in those communities in language, but we can always do more, and we're very happy to have feedback specifically as to what's needed in each community and what works best for them. So I think that was the question, but I'm very happy to answer more specifically if you're able to repeat it, Jess.
Can I add to that the federal government, the state government is not directly involved with our Pacific communities in the broader Pacific region. What Minister Ward was talking about was obviously the Pacifica community here in New South Wales, but certainly the New South Wales government is encouraging our federal government in every way possible to provide support into our region and into the various countries, the nations, and in the Pacific. So we understand they are doing that, and hopefully as more vaccines become available, they will give even more support.
I'd also like to add, Minister Ward and Minister Hazzard, that New South Wales Health and Multicultural Health Communication Service with Multicultural New South Wales are in partnership with the Core Pacific Coalition, and we're developing video messages in different languages to help spread the message of COVID-19 information. Another question here from Indio Times. At this stage, COVID-19 figure double every week. When do we expect numbers to start decreasing? Dr. Gale, it's a question that's been coming up.
Very simply, so we keep it short, we don't know. When people start complying with the rules and stay inside their household until the numbers come down, when they get vaccinated, that's when the numbers will start to come down. But we need everybody to be on board with us. And we keep saying the same messages every day, but there are, as I said, 80% of all of the cases today came from Southwest and Western Sydney. So we need people to listen to the message and to comply. And those of you who are strongly supportive of the messages and are doing what's right, if you could make sure that you tell anybody who you see who is not complying, comply. Make sure you keep us all safe.
Thank you, Minister Hazzard. The community have been impacted heavily with COVID. What is the government doing in order to support their mental health? Is there a chance that we could see bilingual counseling available to meet the needs of the community, or perhaps bilingual hotline?
Thanks, Jess. Look, I know that there is a lot of work going on across the state to support people during this time, both people affected by COVID, so people who are positive or people who might be close contacts. And we have our wonderful interpreter services. In many areas, we have bilingual staff who absolutely do their best to make sure that everybody who is affected by COVID, be they a case or be they a close contact, has access and is aware of the full range of supports that are there and available to them, whether that be financial supports, other welfare supports, anything else that they may need. For people who are affected by COVID, if they are a case or a close contact, they receive health follow-up. So there will be a health practitioner who would call COVID cases to check on their welfare. And certainly if there's any issues that they encounter, that those needs would be addressed. And including for people who speak a language other than English, then they would absolutely be drawing in bilingual staff or qualified interpreters to make sure that people understand what supports are available to them, including mental health supports. More broadly in the community, I know that the Multicultural Health Communication Service and the Multicultural New South Wales have done a lot of work in engaging with communities and providing information and resources to support people's well-being during this period across a whole range of diverse communities.
Thank you, Dr. Gale. Another question from Fred Zhang. New Zealand recently took a nationwide stage for lockdown with one community case. What is your comment on that? Are they too sensitive? And are we still able to trace and track every new case with the doubling up of numbers?
My first comment is that every government needs to make its decision based on its best health advice. And obviously New Zealand did that. They're very sensitive, obviously, because they've had no cases for quite a while. So I think that particularly off the basis of what Victoria and New South Wales have experienced with this new Delta strain, which is so infectious, so transmissible, I think their decision's a good decision. And what was the second part? Sorry, I've forgotten that.
It asked about the cases. Are we able to contact trace every single case?
The challenge around effectively tracing each case is now very substantial because we have so many cases. So although the tracers have taken some steps, particularly to focus on those cases they think really do need to have a lot of work put into them. But it's a challenge, and it will remain a challenge while the numbers are up fairly high.
Thank you, Minister Hazzard. Minister Ward, would you like to comment?
I just wanted to say that there is help out there, and obviously we're following the health advice, but in relation to specific communities, we do have those grants programs, and I just encourage everybody to look at the Multicultural New South Wales website to access those grants programs. There's $5.5 million in emergency support funding that is there, which I've mentioned before. It's open now for application, and so I do encourage everyone to look at that specifically. In relation to lockdowns and going forward, that's entirely based on the health advice, but we will continue to support those communities throughout this period in terms of compliance, in terms of mental health, and getting packages out there directly to support them during this time, no matter what the health orders are.
Thank you, Minister Ward. And we've run out of time again. It's 1 minute to go. So maybe we'll ask our ministers and Dr. Gale for some last words.
Right, I'm happy to go first. So really, as I said at the beginning, the key message for the community from a public health perspective at this time is really to share with you our concern about these case numbers going up, and to really ask a sincere ask to all of you listening to really consider the public health orders, to reflect on them, to make sure that you follow them, that you advise your family and your friends and your community to follow them, to please get tested and please take the earliest opportunity to vaccinate. And again, talk to your family, to your friends, to your community, and encourage them to do the same.
Minister Hazzard.
All I'll say is thank you to all the multicultural media for getting the message out. And the message is essentially 80% of the cases at the moment are in southwest and Western Sydney. We need the community to be with us on the journey. And that effectively is stay in your house. Don't go out unless you absolutely have to. And get vaccinated. And then hopefully we'll get through this as soon as possible. Thank you.
Thank you, Minister. Minister Ward?
Yes, thank you, Jess. I also want to sincerely thank all of our wonderful multicultural media outlets for getting those messages out there. Stay at home, get tested, ring your family, don't visit them, and just observe their health orders, and we will get through this together. And we know most people are doing the right thing, but particularly in our areas, look after each other and let each other know, help each other to get vaccinated.
Thank you, Minister Ward. Thank you, Minister Hazzard and Dr. Gale. And thank you to you, everyone who's joined us online today. A recording of this conference will be online on the New South Wales Multicultural Health Communication Service website. And also, if you have any questions, please feel free to email us and we'll try to tackle them in the next online forum. Thank you very much. Stay safe and get vaccinated.